Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. This video will be probably a topic that a lot of new students, even if you just found out that you are accepted into the dental hygiene or even the dental assisting program, or if you're now in second semester where you're starting to see patients, you're wondering, how does everybody get patients? And I know this was probably the hardest part for me. This was what caused me the most stress. It wasn't even getting the marks in school or doing the tests or doing exams. It was, how am I going to find my patients? Or if you don't pass a patient, how on earth are you going to find another one? So that's what I want to talk to you guys about today. If you haven't seen any of my videos yet, here's a little bit of background about me. So I've been tutoring now since I was about 19. I became a dental assistant at the age of 19. I took dental hygiene a couple years after that. And then I became a restorative hygienist about 2 years ago. So I've been in the field for a while. I'm almost 32 now. So I've been in the field for a while. When I took dental hygiene school, actually the first time, I was about 3 weeks before being done. So I would be graduating in about 3 weeks, and my school shut down. So I went to a private college, and I didn't know that colleges had to be accredited at the time, because if they're not accredited, they have a chance of just shutting down. Like literally the owner of the college walked away. He declared bankruptcy. So all of our hard work, all of our efforts meant nothing. Literally meant nothing. We were not able to take the board exam. We were not able to do anything without being done school first. So I had to take the hygiene program twice. So for those of you who know or who think that the dental hygiene program is stressful, just be happy you didn't have to do it twice, because the second time was not any easier for me. The academics, yes, I knew what to expect, so that was easier, but I still had to find patients, I still had to pass, I still had to do all of that. So just be happy that you don't have to take school twice, okay? And if you do have to take it, because let's say you did not pass the first time, or you surpassed your chances of taking the board exam and you are taking the program for the second time, think of it this way: it is possible, it is okay. If dental hygiene is something you want to do, who cares if you have to take it twice? If this is something you absolutely want, work hard for it, because it's amazing, okay? But we can do that in another video. And I'm sorry, I just have to blow my nose. I have really bad allergies, so I'm just going to pause this for one moment here. Okay, everybody, sorry about that. I have horrible allergies, so I just really had to blow my nose. So I am so sorry. Oh, and some of you have been asking me what this is about. Sorry about that. I sell lip scents on the side, so the lip color doesn't come off. So I went to a dental office yesterday and then a dental office the day before, because they wanted to see some lip scents colors, and that's why I still have it on my arm. So sorry if that looks a little bit weird. But anyway, so let's talk about how to get patients. So you might be wondering, since I've obviously taken the program twice, how was I able to get patients? Well, the first time I took the program, I was taking the program in town. So I lived about 20 minutes away. That's it. It was a lot easier. So all of my pretty much friends and family, they could come to be my patients, and that helped a lot. But the second time, I lived about 2 hours away, and none of my friends, none of my family would come to be my patient. It's not really that far, like 2 hours, come on, but nobody would come for like 4 or 5 or 6 appointments to be my patient, right? And each appointment is about 3 hours long. So I had to find my own patients. I was in a city that I had never lived before. I didn't know anybody, so it was tough. So what did I do? Depending on where you live, you may or may not have this, but I advertised on Kijiji. So I just simply put up an ad saying, and at the time, there was not a lot of people who thought about doing that. And at the time, social media was just starting to come into play. So like it wasn't as popular as it is now. In fact, Facebook I might have had for like a year, but it wasn't that popular at the time. So now it should be a lot easier for you guys. So use social media to your advantage, okay? Just post something saying like, hey, I am so excited to be in my final semester of dental hygiene school. I need 2 more patients. So if you don't have insurance, this is perfect. Please let me know to set up an appointment. I am happy to see kids. I am happy to see those who haven't had their teeth cleaned in 10 years. I'm happy to see everybody. So use that to your advantage, because when I was a student, I posted on Kijiji. I just posted an ad saying, and I even made up my own image. I don't even know how I did that at the time, but you could use Canva now. That thing is awesome. I will actually post the link on the bottom. But just post an ad saying, I'm a dental hygiene student. I have a year of experience, you know, depending on how long you've been in school at that time. I'm looking for child patients. I am looking for people who haven't seen the dentist in a minimum of 3 years. You know, be as specific as possible, and then say, you know, this is perfect for those who don't have insurance. All you have to do is show up and you will learn so much. You could even offer to pay for their appointments. That is totally up to you. I didn't have the money, so I wasn't able to help people out like that, but I do know a lot of people in my class, they had a lot more patients than I had, because they offered to pay for their appointments. Plus, I don't know how it will be for your program, but in my program, you had to take like a certain amount of x-rays. So if I needed, let's say, a certain amount, then I would ask a patient, you know, you need those x-rays, but I can see that you can't afford it, but I would be happy to pay half, you know, or something like that, you know. So I did do that a lot, but I didn't pay for their full appointment because I just simply couldn't afford that. But that could hurt you too, because I had people in my class who would pay for somebody's appointment, but then they wouldn't show up because they didn't care as much as somebody who did pay. But that depends. Like, that could go either or. But you do have options. So that's how I found patients. I even posted, like, I put posters at the mall. I would just simply ask people at the mall. Like, I remembered, you know, I'd be in a store shopping for a shirt or something, and if a cashier seemed to be overly talkative, then I might say something like, oh, you know, sorry, I'm just so tired. I've been in school since 7:30 a.m. I've been looking for a patient to clean their teeth. Oh, would you be interested? You know, something like that, right? That does help. Just make conversation. It does help. But that's how I found my patients, was off of Kijiji. And then the patients that I did have, I would say, hey, do you have a sister? Do you have a mom? Do you have, you know, would they like to come in too? Because I need, you know, 2 patients, 3 patients, 4 patients, whatever, right? Because then you also have to keep in mind that you will have those patients who don't show up, or they cancel the night before, and you're like, how am I going to find another patient for my 2-hour clinic the next day? This will hurt my overall mark if I don't have a patient. Or you could be thinking, I need that patient in order to pass. How am I going to find somebody? So it does help to just simply talk to as many people as possible, and then also ask, could I have your cell phone number to send you a text if anybody cancels, because that would totally help me out. You know, you could do that also. Let's see. But yeah, that's how I found my patients. But I think I was also lucky because I was just able to find people on Kijiji. I had no idea who they were. I didn't know who would be showing up. You know, like I didn't know if they were crazy. I didn't know if they would actually show up. I also talked to people who I used to work with, you know, saying things like, hey, do you know anybody in the Toronto area who would want to come in to have their teeth cleaned? So I was able to get some people that way too. But that's just how I got my patients. So it is something to start thinking about, because that's probably one of the hardest things, because even if you have patients, your patients have to meet a certain criteria. But don't worry about that yet. First, find as many patients as possible, because it doesn't hurt to have too many. It does not hurt to have too many, because even if, let's say, you need more people who haven't been to the dentist in 10 years, and somebody you know in your class is saying, well, I need more people who are between the ages of 7 to 13. You may know a lot of people or have a lot of patients in that age that would help her. And then maybe she has certain patients that would help you instead. So it does help to just have as many as possible. Yeah, so I hope that helped. Try not to be like, oh my goodness, how am I going to find patients? Because it's just all part of it. We all had to do it. And hopefully the program that you are in, your school has a good amount of patients who are coming in every, you know, like 3 months, 6 months, 9 months, whatever. That would be nice. My schools just never had that, or I would call them and then they would be the ones who wouldn't show up, and they would say, take me off the list. So you just never know, right? And another thing that I just thought about is feel free to post on social media, which I did say that, but ask dental assistants and dental hygienists. Say, hey guys, I'm in my 2nd semester. I need patients. Is anybody living in this area who would help me out? Because trust me, we love to help you guys out. We love it. So like I'm a part of the Dental Hygiene Network on Facebook. That's a good place to send a message to people, you know, just simply posting, saying, hey guys, I'm in my 2nd semester, 3rd semester, last semester, whatever. I need patients. Can anybody help me out? But obviously keep in mind that they probably have pretty healthy mouths, right? So you may not need a lot of those types of people, but it is always nice to have too many patients, because you never know who they may know. They could say, oh, well, I know somebody who needs their teeth cleaned. Can I give her your number? You know, or something like that, right? So it doesn't hurt to have too many patients. So, okay, guys, so I hope this helped. If you guys have any questions, please let me know, and I will see you guys in the next video.